Hi, this is Dr. Sylvester, and I'm going to talk to you today why I think you should see Next Step Foot and Ankle Clinic if you have or have been diagnosed with Morton's neuroma. Morton's neuroma is actually a very specific thing that describes pain on the ball of the foot, up here just right short of the toes. First of all, it's the right diagnosis that we can give you. The problem that I see with a lot of people, they've been told they have a Morton's neuroma, and they really don't. There are several structures down there that can be sore, and they're sore for different reasons and different problems that the patient has that can contribute to that. So we can get you the right diagnosis. Secondly, we can describe to you, or hopefully we can describe to you as to why you're getting it. There are certain foot types and certain contractures that can occur that play a role in the development of a neuroma. Thirdly, most neuromas can be treated conservatively. You don't have to do too much to them as far as you can get the pain under control in most patients. It's not true in everybody, but in most patients you don't need to have surgery or anything. You just get the right shoe gear with the right arch support, with the right maybe steroid injections and pills, and in a short period of time the pain is under control. Myself, I actually have a neuroma on my left foot, but I know how to treat it, so it really doesn't bother me that much. I'm very active. I try to do exercise, run 3 or 4 miles 3 or 4 times a week, and it never bothers me. So that's the kind of treatment you can do with a neuroma to get it so you still have it, but it doesn't bother your life that much. And lastly, if you do need surgery, there are a lot of different treatment options. Some have better results than others, and we are pretty advanced in our nerve surgery techniques. So we have a certain technique that we use that, let's say you want to get that neuroma out, which is a little bit, we try not to if we don't have to. There's ways to make the nerve feel better by not removing the nerve. But let's say you have it, we use a technique that was developed in the University of Washington to remove nerves that causes much less recurrent problems later. I have almost every month a patient that come in with the previous nerve surgery done at St. Elsewhere, where their nerve has recurred and it's back and it's bothering them the same as it was or worse than it was before the surgery. And that's simply, there are ways you can treat it to prevent that. So just so you know that there's a big difference in techniques in how to do nerve surgery, and appropriate nerve surgery seems to have a much higher success rate than just off the street kind of nerve surgery. And lastly, I think that a good reason is that we'll try to make you feel like, most people tell us after they've been to our clinic that they feel like they got a much better examination and they're much more comfortable with their diagnosis. And lastly, for neuromas, you don't necessarily ever have to do anything. They're not life-threatening. And we'll tell you that up straight. It's basically a symptomatic problem. If we can get rid of your symptoms, that's all you need to do. So there are some advanced therapies that we use also to help people through very minimally invasive techniques to help them get rid of their nerve pain on the ball of their foot. So if you have a problem with the neuroma, give us a call at the Next Step Foot and Ankle Clinic. And thanks for listening to my neuroma talk. Appreciate it.